At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
As we recruit new faculty to join our team, and sometimes nursing programs are also recruiting a new dean, a new director, it's important to establish standards of excellence. What are those benchmarks that we are going to identify as the minimum standard for the teaching strategies that we're using and the faculty commitment to excellence? Welcome back, everybody, to Dr. Sellars Educate. We're happy that you're here. Make sure you go ahead and print out your study worksheet if you haven't already. It's listed right here in the description. This is going to help you stay focused as we move through our content today. In our discussion, we're going to talk about what does NCLEX have to do with clinical judgment and how does it align with faculty excellence. Our commitment to excellence starts with taking a look at the detailed test blueprint that is on the NLN website in the candidate handbook. The next step is to do a self-assessment. So where are my competencies in alignment with what NLN says they should be? What are the specific behaviors? Remember, competencies is not just about knowledge. Competencies are about our ability to demonstrate that specific skill set in a way for us as nurse educators that facilitates learning, that helps our students have that deeper sense of knowledge, application, and decision-making ability in order to provide the safest patient care possible. So first and foremost, we like to start with our devotional. So for the devotional today, we are focusing on day 13. Still talking about lifelong learning because we know how important it is. So day 13, if you want to turn there with me, it's on page 15, and we're reading from our Rooted in Wisdom 365-Day Nurse Educator Devotional. Once you stop learning, you start dying. This is a quote from Albert Einstein. Our devotional for our time together today. As educators, we are also lifelong learners, staying engaged with new research, best practices, and emerging trends allows us to provide students with the highest level of education. Learning never stops. I want to say that again. Learning never stops. And that is a beautiful thing. Today's action, you will take just one new piece of nursing research from today and share it with a student or a colleague. So it could be the conversation we're having today. Again, it's all about alignment between how we show up in our learning experience with our students. So that's the didactic, that could be the clinical, that could be the SIM or the skills lab. And how does it align with the NCLEX blueprint? And most importantly, how does it help our nursing students provide safer patient care? So that's our topic for our conversation today. Our Bible verse is taken from Proverbs 1:5. Let the wise listen and add to their learning, and let the discerning get guidance. Our reflective question is, how can I make learning a joyful, ongoing journey in my career? Again, how can I make learning a joyful, ongoing journey in my career? Sometimes learning can be challenging, even for us as nurse educators. Maybe we try new technology. Maybe we engage in facilitating knowledge with our students about concepts that are new to us. Or maybe we're teaching for the first time, just trying to figure it out. Not only the content, but how do I communicate this information in a way that is going to help students learn? All right, now I want you to think about the second part of your reflective moment is to think about and consider where your knowledge gaps are. So let's go ahead and go there together. If you will open up a new tab, go to the nln.org website. And I want us to take a look at the actual blueprint. All right, so I'm going to share my screen so we can go there together. I'm just going to choose C&E, but whatever exam you're taking, you can choose the C&E handbook, candidate handbook of your choice. For this one, we are going to go straight to the detailed test blueprint, okay? And this is what I want you to do. You are going to do that self-assessment. All right, so let's back up. Let's first start with the overview of the blueprint. So you see for C&E, there are 8 competencies. I want you to think about, now that you know our topic, which is NCLEX alignment with clinical judgment and our evidence-based teaching strategies, I want you to think about what are the competencies that align with this topic. So just pick maybe 3, hint that there's several that you could easily align. But I want you to do that first. We're taking a different approach in our conversation today. Go ahead and write down just 3 competencies that could align with that subject, with the specific topic that we're exploring. And then second of all, I want you to take a look, and you can do this after we end our time together today. I want you to take a look at specific behaviors that you think would align with that competency. Okay, for each of the competencies, there's what we call subcompetencies. And these are specific behaviors that really do describe how we show up as our best self to support the learning journey with our students or within the academic setting. All right, so that's the assignment. Again, a little bit of homework that you're going to do as you think about how you can become the very best nurse educator that you can possibly be for our community, because that's ultimately who we're supporting. It is our community. And next, what we're going to do is take a look at our content for today. We're going to flip over and use Canva. And Canva is our presentation platform that we love to use. And we're also going to use Prezi as our camera. All right. And Prezi allows you to make your presentation content, and also it allows you to share it on Zoom. So we use Zoom to record, and we're right now using YouTube, or you could be listening to us on our podcast. We stream across multiple channels, this as an audio, if you choose to listen that way. You know by now that C&E in 60 Days is our signature program. What colleagues love so much about this program is it's very structured. So we follow a 7-week study plan to ensure every single week we're engaging in micro learning. So for some of you all, you have decided that you're going to be more self-directed on your 60-day journey, and that's great. So you're using maybe our 7-week study plan. We continue to consistently have 98 to 100% success rate when following our 7-week study plan. Now that's the key. You have to follow the plan. So what does that mean? No additional resources. Only use Billings and Halstead, either the 6th or 7th edition, as your primary source. Okay, and we're going to take a look at some pages. I'm going to share, that's going to be a bonus for this conversation today. I'm going to share some specific page numbers for the 7th edition to help you ensure that you are accurately closing your knowledge gaps related to critical thinking, critical reflection, and clinical judgment. All right, and then the second step I want you to take as you think about our conversation today is, where's your gap? Part of your journey is truly closing your knowledge gap. So yes, we want you to achieve that passing score, but most importantly, we want you to become a better nurse educator. C&E in 60 Days is a great way to do that. And we actually will have a video at the end of our conversation today where you can learn more about our program. You can also go to our homepage and find information about what it entails and what your next steps may be. So here's the question we're considering. Does every faculty member in your program define competent clinical judgment the same way? What do you think? Write down for us, yes or no. Do you think that is a yes, that if you survey, let's just say 10%, just 10% of your colleagues, would they define clinical judgment the same way, and how we evaluate it? All right, so that's the next question. What evidence supports our answer? So we will want to do a little bit of analysis, asking that one question: how do you evaluate clinical judgment? How do you support and how do you define clinical judgment? And then the evidence. So we will want to find out from colleagues, how do you validate that? What ways are you engaging in formative assessment with your students? And what are the opportunities when we think about summative assessment? The next resource we want to point out, which is an excellent one, which is the NCSBN website. This is where you're going to find information specifically about NCLEX and how we can support our students not just to do well on the NCLEX, even though we know that's a really important indicator when we think about our programmatic outcomes for the accreditation body, also for our community, because students are smart, parents are smart too. So they want to know, what are your NCLEX pass rates as students are considering which nursing program they are going to attend and maybe even apply to. Maybe they still apply to several and they make their final decision based on those programs that they're accepted into. So that's what I wanted you to think about. First and foremost is, have you been to the NCSBN website? If you go there, if you open up a new tab, let's just talk about some resources that are available. So at the very top, you will see some information about the NCSBN. You will also see when you click on the link, and this is just from the home page. So you go to the home page, and then once you're at the home page, you will see NCLEX on the left-hand side. Okay, so once you go to NCLEX, you're going to see some information about preparing for success, be ready for the exam day, and get your results. This homepage is actually an excellent resource, not just for us as educators, but also for our students. So that's another takeaway. Think about and take a look at how often you're really engaging with your students to go to the NCSBN website. And then the next step you want to think about is that competency alignment. So if you haven't done it yet, we want you to, again, think about 3 different competencies that align with this content that we're exploring in our conversation today. Let's go ahead and take a look at our thought-provoking question and see what you all think about this specific question. All right, so now we're going to flip back over to Zoom and take a look at our thought-provoking question. All right, here we go. When you get to the CNE exam, remember that there are going to be 3 different options, okay? But there's only one correct answer. So 3 options for the 150 questions. You will have 3 hours to take the exam, and you want to pace yourself, okay? So you want to think about the time that you have and pace yourself accordingly. A nursing program has incorporated clinical judgment items and case studies throughout the curriculum, but faculty apply different standards when evaluating students' decisions. Which actions should the program prioritize? We have A, increase the number of clinical judgment items used in every course examination. B, calibrate faculty judgments using shared criteria and scored student exemplars. Or C, add comprehensive content reviews before students enter the final semester. So you want to think about, what is this question really asking me? And second of all, what is it that I know for sure about content related to this question? All right, I'll give you all a second to think through that thought-provoking question. And before we take a look at the answer, this is the bonus part. I'm going to go ahead and give you some page numbers from Billings and Halstead's 7th edition for you to take a deeper look at related to clinical judgment models and deliberate practice theory. This is all related to critical thinking and clinical reasoning. And just as a tip, this also aligns with Competency 1, where it talks about under Competency 1G, create opportunities for learners to develop clinical judgment. It also aligns with Competency 2, where we are under Competency 2A, it says identify learners' attributes and needs based on consideration of learners' diversity, social determinants of learning, and past clinical education and life experiences. All right, so right there, that's Competency 1 and 2, because we want to meet our students where we are. We know students learn differently, just like we do as adults. So we want to be able to meet students where they are. That means we have to be able to engage in evidence-based teaching strategies that are going to help validate students' knowledge. That's why looking at deliberate practice theory is so important. All right, so chapter 18 is where you're going to focus to help you close your knowledge gaps. If you chose option B, give yourself a round of applause. We want to calibrate faculty judgment. So this is where we're coming together. It's somewhat of a shared mental model because we want to come together with our colleagues and find out, okay, how do you define clinical judgment? How does it show up in your teaching strategies? How does it show up in your evaluation strategies? How does that thread across our curriculum? So we want to look at the horizontal alignment in our curriculum, so course to course, semester to semester, but also we want to look at our vertical integration. How deep do we go within our 15-week semester? How do we scaffold that learning when we think about critical reflection and clinical judgment? So, chapter 18. In the seventh edition, go ahead and write down these specific page numbers. If you're already in our 60-day program, if you're already in our self-paced course, then you already have these page numbers. But this is the seventh edition. It's going to be pages 387, 394, 402 to 403. And then for clinical judgment models, the seventh edition has done a wonderful job of going deeper into clinical judgment. So we really like the seventh edition for that reason. So that's going to be page 402 and page 565 through 566. And then deliberate practice theory. Take a look at page 390. This is going to help you go deeper in understanding exactly what deliberate practice theory is all about and why it is extremely important when we think about the content that we are including in our curriculum. So, where does sterile technique show up? And then, second of all, when are students having a chance to truly apply that concept of sterile technique? All right, so how are you feeling? How are you all feeling about these concepts? Are you feeling lost? So that would be a 1. Or 5, you feel like you're ready to teach. So go ahead and put that in the comment section for us, or you can just write it down on your sheet of paper. The goal, though, as you're moving forward on this journey, is that it is transformational. So, yes, we're engaging in a transaction right now. You're exchanging your very precious time. We believe time is your most valuable asset because once it's gone, we can't get it back. So this is a transactional experience, and our goal is that it is a transformational experience. This is why we invest so much time into developing valuable content every single week so that you can become a better nurse educator. And hopefully, it's helping you clarify any muddy points that you have and helping you go deeper as a nurse educator so that our students can not only be more successful in our nursing programs, which that's a great thing, right, for it to happen. It's a great opportunity for our students to become stronger in their skills because we are more effective in facilitating this learning journey with our students. It's even more exciting though when we see ourselves become a better nurse educator. I know for me, starting my nursing journey more than 30 years ago, I always wanted to be a nurse since I was a very small toddler because I saw my mom being cared for by an exceptional nurse, and that really created a lasting impact on me. I can still remember that moment to this day. And then all along the way, there were other investors that really committed to me being the very best student that I could be, me being the very best nurse that I can be, and even me being the very best nurse educator I could be. As you're thinking about the impact that you have on your students, just remember that just like our decision to become a nurse was probably affected by, or influenced by at least 2 or 3 people, we can have that same positive effect on our students. So that's another reflective moment we want you to take is just think about where's the biggest opportunity as it relates to student success? What could we do differently to help our students be just a little bit more successful? Have a little bit deeper understanding of a concept that will help them develop that clinical judgment, that will help them recognize when something's not quite right, be able to identify what their next step should be, prioritize accordingly, and then execute, being able to know where to find those resources, where to find whatever equipment or supplies they need to deliver the safest patient care possible. All right, and now we're going to go to our content. And when you take a look at the content, we want you to also think about what your next steps are going to be. Now, we know that everybody's journey is a little different, and that is understandable because we all learn differently. The goal, though, is that you're thinking about not only what your next steps are going to be, but how you're going to get there, what's going to help you have that deeper understanding of concept. It could be that you are struggling with understanding the reading in the textbook. That's very common. So if that's you, if you're struggling with just understanding what the textbook is saying, this is what we want you to do. Start at the beginning of the chapter. So we talked about chapter 18 as an example. We gave some page numbers. If you're having difficulty understanding the concepts, the terms in the textbook, we recommend that you start on page 1 of that chapter because this is going to give you a general overview of what that chapter is about. Okay, so that would be our recommendation if you're struggling with some of the terminology or what some of the concepts actually mean. Go back to page 1 of that chapter. These are 3 key strategies that we want you to write down to help you have stronger NCLEX alignment, to help advance clinical judgment, and to also help our students provide safer patient care. Number 1, we should stop treating the test plan as a content checklist. When we look at that NCLEX test blueprint or test plan, we often talk about the concepts that are included, and that's important. We absolutely want to look at that test plan and align it with the curriculum, our curriculum, to make sure that we're still on track with including concepts that are essential for students to know. We have to have 2 categories, and we have to think about that from a mindset standpoint. What is information? What are concepts that my students must know versus what are those concepts that are nice to know? All right, so we want to be clear about that. And as you're thinking about the test plan, there are a couple of other points we want to make regarding the test plan. First of all, if you haven't been there, we encourage you to go there. The test plan is going to help us identify those entry-level nursing activities, the content that we should be including in our curriculum, clinical judgment expectations, and item development guidance. We want to be able to map these expectations across the curriculum. Again, we want to ensure that there is depth, right? So that's that vertical, as well as the horizontal alignment with the concepts that we are integrating into our curriculum. All right, so these are a few questions you want to ask yourself. Number 1, where is each expectation introduced? If I expect my students to understand sterile technique and be able to demonstrate that when they're inserting a Foley, when did I introduce that concept? When did students have a chance to practice that concept? Number 2, when did students practice it? So when in the course was it taught? When did they practice it? And where did they practice it? Was the skills lab? Did I introduce it from a clinical application standpoint in the classroom? Did I bring in a Foley tray? Did students have a chance to practice that skill? And then, did they practice it independently, or were they coached up until the point where they did it at the bedside? Now, that's an important step because sometimes students don't have enough chances to practice a skill. And then when they get to the bedside, they aren't competent. They aren't strong enough to the point where the clinical faculty feels like they need more remediation, more practice time. All right, so those 3 questions you want to ask yourself. Number 1, where is the expectation introduced in the curriculum? Number 2, where did students practice that specific skill? And then number 3, did they get a chance to practice it independently with minimal coaching? All right, number 2 is going to be measuring decisions, not recognition. That's what we want to focus on. Our ability to actually quantify that students are able to demonstrate this skill is important. All right, so some questions we want to ask ourselves there is, number 1, which model did we use? NCSBN, Lassiter's model, or it could be Tanner's clinical judgment model. So which model did we use, and how does it align based on our mapping to our curriculum? How many chances, again, did our students have a chance to actually demonstrate full utilization, full integration of that model, using that model as they were making decisions in patient care? And then number 3 is that calibration, going back there. So calibration just means that we're all aligned, right? We're all on the same page as faculty. We are defining clinical judgment the same way. And when it comes to faculty, there may need to be some additional faculty development, and that's okay because that's going to establish ground zero for all of us. So we have clarity about how we define clinical judgment, the teaching strategies we're going to use to support students developing clinical judgment consistently and advancing it, and then just thinking about what our next steps are going to be. We shouldn't automatically add more questions. We shouldn't automatically add more unfolding case studies. We want to do a deeper dive, exploring from faculty what the feedback they have to provide based on student feedback, based on student outcomes. And these are some considerations we want to think about. Number 1, what competent performance actually look like? Number 2, which cues are clinically relevant? We talked about cues in a previous snapshot. Number three, how are priorities justified? How do we make decisions about what priorities should be? So again, this is all about faculty alignment. Number four, how is student performance actually evaluated? And I would add when, okay, just like we did with point number one. We want to know, be able to clearly identify when do students have a chance to practice, when did they have a chance to practice that skill independently with minimal coaching, with minimal prompting. The five rights always come to mind for me. Whenever I do consultations and site visits for skilled nursing facilities, that is a common practice that I follow. Why is that? Because the state, CMS, they always observe that. It's a standard practice. And what do we know? Medication errors are they still happen far too often. So when we think about five rights as an example, something basic, some of our clinicians still need prompting about the five rights. Well, if I don't know the five rights, I'm not able to articulate them to a surveyor or to a consultant, then it's highly likely that I'm checking them every single time that I give a medication. Competency alignment for the NLN nurse educators is really aligned with the NCLEX test plan and thinking about how do we prioritize the actual behaviors that we're integrating in our curriculum is a key first step. So if you chose curriculum, which is competency four, for the actual competencies that you have listed, you are correct. If you chose competency three, which is all about evaluation and assessment strategies, you're absolutely correct. It does align, as well as change agent and leader, continuous quality improvement, and academic and alignment with our community and academic standards, university and academic standards. So the reality is it aligns with seven of the eight competencies, and some could even argue that it also aligns with Boyer Scholarship Model. When you're on this journey to achieve success, not just on the CNE, but also in your nursing program, it's important to understand what our standards should be. The NCLEX test plan is absolutely a tool that we should use, and it should guide us when we're looking at the mapping of our curriculum, as well as when we're aligning with the faculty expectations, specifically as it relates to clinical judgment. We hope the snapshot has been helpful, and we look forward to seeing you the next time. Make sure you take some moments to reflect, to debrief from the conversation we've had today, and we look forward to seeing you in the next one. Take care, everybody. It took me almost 8 years to pass the certification exam. As a nurse educator and even as a nurse, I knew I wanted to achieve my certification in my specialty. And when I became a nurse educator, it was loud and clearly stated that NLN C&E is the hallmark of excellence when it comes to being a nurse educator. So I knew it was on my bucket list. I had no idea it would take 8 years for me to actually get it off of my list. And the reasons why is because first and foremost, I didn't know where to start. Okay. I had no idea what resources to use, and it was hard to find a community to support me that would go along with me on this journey to achieve CNE success. The good news is you don't have to go through the struggles that I did. We have a community with Dr. Sellars Educate specifically designed to overcome and break through those barriers to achieving CNE success. It starts with number one, the right resources, number two, the right experts, and number three, compressing time. 60 days, that's all that you need to accomplish your goal of passing the Certified Nurse Educator exam. The other point I want to remind you all of is that life happens. Sometimes we get off track. And for that reason, when you join CNE in 60 Days program, you have access to the recordings indefinitely. They never expire. So no longer do you have to wait. Do you have to put it off like I did? You're ready now. And we're ready to help you. We're walking along with you every single step of the way until you are successful. Go to our website, drsellarseducate.com. You're going to see CNE in 60 Days right on our homepage, and we look forward to seeing you in the program. Oh, one other point, there's nothing else to buy. Once you register for the 60 Days program, your textbooks, which are going to be Dr. Caputi's CNE review book, Billings and Halstead, as well as your study workbook that includes the 7-week study plan, are going to show up on your front doorstep. Okay, so that's the other benefit. So we'll see you over in the CNE in 60 Days program. Have a great one, everybody.